Hi, I'm Dr. Hudson Garrett, Adjunct Assistant Professor of Medicine in the Division of Infectious Diseases at the University of Louisville School of Medicine, and I'm excited to share with you an introduction to the January Aerobotics Clinical Newsletter article. This particular newsletter article is going to talk a little bit about the brand new Joint Commission accreditation standards for Accreditation 360, which to me is one of the most exciting accreditation standards that we've seen in many years, particularly for infection prevention and control across the continuum. When you think about accreditation, most people don't get very excited, but I'm actually quite excited about these new standards because not only do they consolidate the standards, but they also bring to light sort of three basic areas of focus. First and foremost is surveillance, really looking for infections before they ever happen. This is a more proactive approach to infection prevention, particularly things like surgical site infections. The second is prevention. As patients, they want to make sure that we are preventing the infection from ever taking place. No one wants a preventable infection. That's something that we can actually stop from happening in the first place. And then lastly is control, which is a reactive and responsive activity. So when you put all three of these together as a formal equation, surveillance, prevention, and control, we know that we have a formidable chance at actually addressing these deadly and preventable infections across the entire continuum, whether that's in the inpatient setting or in an outpatient ambulatory surgery. I do commend Joint Commission for their efforts in not only consolidating these standards, but more importantly, in bringing these forward so that they make them more manageable for healthcare facilities to actually implement these and really bring evidence-based practices. One of the other things that I'd like to mention is that they don't directly describe every single clinical guideline that we have to use, which gives us great flexibility in the evidence-based practices that we want to utilize, such as the ARN standards or CDC as an example. So I hope that you enjoy this month's newsletter, and I look forward to seeing you in February.